Hey there, Elizabeth Scala here from Living Sublimely Well. Welcome back to another video regarding recovering from surgery. I personally had elbow surgery and am a patient who's gone through the recovery process afterwards. Each of these videos is about a specific topic related to preparing for surgery, what happens during surgery, or the recovery afterwards. Today I want to talk to you briefly about a topic related to pain medications. Your surgeon and perhaps other medical providers on your healthcare team could possibly prescribe you prescription narcotics or prescription opioids for pain. This is normal after surgery, and pain medications of this nature are used in the acute phases of recovery. Sometimes the surgeon and other medical professionals will prescribe these medications standing, which means you take them routinely at certain times of day. And other times, as was in my case, my surgeon prescribed me an opioid medication that was PRN, and PRN means as needed. So what does this have to do with the topic of today's video? Pain medications are certainly needed when you're in intense, acute, high levels of unmanageable pain. You know, if you can't do breathing exercises, or if you can't use heat packs or ice packs or other non-medicative type remedies, when those just aren't working and the pain is that bad that you need these narcotics or opioids. So as I said, I was prescribed opioids and I was taking them PRN, when the pain got too much after the surgery. Something that happens when you're prescribed opioids or narcotics, a unintended side effect, so to speak, is that you can get stopped up. And the more technical term is constipated. Opioids and narcotics both have side effects for constipation. Now, I'm not sure if your surgeon talked to you about this or your other type of medical provider. Often the side effects of these medications are not spoken of because either they think you already know just from common knowledge, or perhaps the surgeon thinks it's not his job to tell you about side effects of medications and that someone else on the team is going to do it. Who knows? Alternatively, you already may know about this if you've been prescribed opioids or narcotics in the past for other instances, or you may take a medication that causes constipation. So you may already be privy to this information. But if not, I'm here to share it with you. You'll definitely need the pain medicine if you're having that intense pain. So I'm not telling you not to take it, and I'm not telling you anything about medications. I'm not your provider. But if you want to avoid constipation, because I did, so my surgeon told me take one pain pill the night of surgery, right before sleep, and then one when I woke up in the morning, regardless of if I was in pain or not, because there was an anesthetic that was numbing my arm, and the surgeon was not sure when that anesthetic might go away, and he didn't want me to have shockingly amounts of pain that I wasn't, prepared for. So I did take the pain pill the night of the surgery and then that subsequent next morning. And then I did need some that first week. And I did notice personally, I started at the beginning to get a little bit stopped up. So not going to go into too much detail there. But what kinds of things can you do to avoid constipation or to minimize the amount of constipation you might experience? So what you put in your mouth, food and drink wise, can absolutely help you reduce or avoid constipation. And another thing is get up and move. As a nurse who used to work in a hospital, I had friends who worked in surgery, other nurses who worked in surgery, and there was always big initiatives at the hospital. Ambulate early, get patients out of bed after surgery. So first of all, get yourself up and walking. Walking is a great way to reduce the chances of constipation. Just getting the body moving helps mobility. And then the food and drinks. So drink copious amounts of water, which a lot of water. Keep yourself hydrated. You also might drink pineapple juice and coconut water, depending on your own dietary restrictions. Those are another good ways to flush the system. And then foods. You want to look for foods high in fiber. So what does that mean? Fruits, berries, bananas, anything that's a fruit, apple, high in fiber. Vegetables, carrots, broccoli, Brussels sprouts, spinach, kale, beets, fruits, vegetables. Avocados are high in fiber. So if you like avocados, you can maybe whip up yourself some homemade guacamole. Beans, so any type of bean is high in fiber. Chickpeas, lentils. So, and you can always, of course, go to El Goog, get yourself on your device and do a little search yourself. But I highly recommend staying hydrated, keeping moving, eating lots of fruits and vegetables, and looking for ways to incorporate more fiber into your diet. I'd love to hear from you, what you thought about this video. Any comments or questions, leave those below. Additionally, I'm always looking for ideas for topics for this vlog. So if you have a specific question related to preparing for surgery, what happens in surgery, or the recovery from surgery, feel free to leave that question on the video or email me at support@elizabethscala.com. Otherwise, appreciate your tuning in. Check us out in the next video, and thanks for watching.